There is a physiological imbalance that explains the higher prevalence of anxiety, depression, and insomnia in females. This imbalance is called blood deficiency. In this series of videos, we will present the signs and symptoms of blood deficiency. We will present the causes of this condition and provide you with practical and effective management strategies. In Chinese medicine, blood does not only refer to the red liquid that flows into our blood vessels, it also represents our body's ability to regulate the neurological system, and especially stress and sleep. When blood is deficient, our body lacks the ability to nurture the neurological system, and it can impact also the heart and the period. In the next video, we'll give you the tools to detect signs of blood deficiency, to be able to detect this condition and manage it proactively. Blood deficiency is a lack of blood, which is a physiological substance that nourishes the tissues, but also nurtures the heart, regulates the neurological system, and creates the period. In this video, we're going to present the signs and symptoms related with blood deficiency. People with blood deficiency often have a pale complexion, but also pale lips and a pale tongue. In my clinical experience, one of the most specific signs of blood deficiency is having pale, dry, and brittle nails. Dizziness and palpitation is quite common in people with blood deficiency, but these signs and symptoms are not very specific. Some people have anemia, in which case fatigue may be more prominent, but most people who have blood deficiency do not have low hemoglobin levels. Blood deficiency is much more common in females than in males. This is because females experience menstruation, but also pregnancy, breastfeeding, and childbirth. Blood deficiency is easier to detect in females because the period might be delayed, it might be scarce in quantity, and pale in color. As we mentioned, blood has a function to regulate the nervous system. People who have blood deficiency may be nervous, vulnerable to stress, and also have fluctuating mood. They may also have headaches, muscle tension, shaking, and chest tightness. The sleep is generally very shallow, with frequent awakenings during the night and frequent dreams as well. If you have detected signs of blood deficiency, you may want to know where it comes from. We will explain this in the next video. The causes of blood deficiency include constitution, chronic stress, exposure to screen, menstruation, and disease of the metabolic and digestive system. Blood deficiency can be part of the constitution of a person. In this case, the signs and symptoms of blood deficiency will appear from very young. However, this does not mean that there is no way to regulate and improve this imbalance. One of the most common causes of blood deficiency that we observe in the clinic is chronic stress. Recurrent stressful situations at work and at home can exhaust our nervous system, leading to blood deficiency. Another common cause is exposure to screen. 2000 years ago, the Yellow Emperor classic told us, watching for a long time damages the blood. So frequent and recurrent exposure to screens such as laptop, computers, mobile phone, television, etc. can damage the blood, leading to blood deficiency. Menstruation can also deplete blood, especially when females have heavy periods. This explains why blood deficiency is much more common in females than in males. Pregnancy and breastfeeding can also reduce blood, as the fetus feeds on blood and milk is produced out of blood. That is why it is so important for female after childbirth to have a sufficient period of rest. Finally, an increasing cause of blood deficiency especially in males, is weakness in the digestive and metabolic system. These systems are related to the spleen and spleen deficiency in Chinese medicine. When the spleen is weak, it cannot produce energy and blood, which can lead to blood deficiency. Now that we understand where the blood deficiency comes from, let's see how we can manage and rebalance this condition. Improving a situation of blood deficiency with lifestyle modifications is possible, and it will have long-term benefits on health, especially mental health, period, and hair quality. It is critical to address the causes of the consumption of blood before starting to replenishing it. Excessive bleeding and deficiency of the spleen must be addressed if they are the cause of blood deficiency. But more importantly, stress management strategies must be in place to avoid the consumption of blood from chronic stress. Effective stress management strategies include mind-body therapies such as meditation and Tai Chi, but also exposure to nature, regular exercise, social interactions, and music, etc. We have covered the topic of stress management in other videos, so feel free to refer to these videos if we want to learn more about how to apply these techniques. It is also important to limit exposure to screens. So if you have to use the computer for your work, try to have screen breaks every 2 hours or so. And also when you get back home, avoid watching the television or your mobile phone. Some foods and herbs can be very effective in nurturing and replenishing blood. These foods include red dates, goji berry, black beans, sesame, and bone marrow. Carrots, berries such as blueberries and strawberries, as well as a moderate consumption of red meat and raw sugar can also help to nurture the blood. If the blood deficiency is too severe, you may need the help of a Chinese herbal medicine practitioner to have herbal treatments appropriate for you to rebalance your body. My name is Yoann Birling. I'm a clinician, lecturer and researcher in Chinese medicine. We're going to upload videos on health, Chinese medicine and psychology weekly, so please subscribe to the channel. Like this video if you did like it, and take care.